Imagine that one day, out of the blue, you notice you're starting to lose vision in one of your eyes. Nothing seemingly had been wrong until then, and imagine then you get a diagnosis of multiple sclerosis. Tonight, we have the privilege of conversing with cardiologist Dr. Michelle O'Donoghue, who's lived that scenario and has experienced firsthand how lifestyle changes, including adopting a whole food plant-based diet, helped put the disease in remission. I'm Jim Spellos from Planned Parenthood Metro New York, and along with my co-host Judith Zerden and Ben Martins, and let's get you all onto the screen rather than just me being here. There we go. With the gang, as always, we are here to welcome you to this episode of Heart to Healthy Heart, plant-based conversations that can save your life. As always, we encourage you to use the chat box to tell us where you're viewing from, as well as to ask questions of our special guest. We'll try to get to as many as our 30-minute slot accommodates. Now, let me introduce our guest. Dr. Michelle O'Donoghue is an associate professor of medicine at Harvard Medical School and a practicing cardiologist at Brigham and Women's Hospital in Boston. She's also senior investigator in the Thrombolysis and Myocardial Infarction Study Group, an academic research organization that conducts global clinical trials. She's the inaugural incumbent of the McGillicuddy-Logue Distinguished Chair in Women's Cardiovascular Health. She earned her medical degree from Columbia University College of Physicians and Surgeons right here in New York City, and she completed her residency in internal medicine and fellowship training in cardiovascular medicine at Massachusetts General Hospital in Boston. Subsequently, completed a Master's of Public Health degree at the Harvard School of Public Health. She was diagnosed with multiple sclerosis at age 33, which sparked her interest toward better understanding the relationship between diet and disease. Now, she's a vocal plant-based diet advocate at her hospital and through multiple education venues. Dr. O'Donoghue, such a pleasure. Thanks for being here tonight.
No, thank you for having me. It's terrific to talk about this important topic.
Lots to unpack, and we can certainly take more than a half hour, but let me just open up with the initial approach, which is tell us more about the story of coming down with multiple sclerosis and how that led you, if it did lead you, into following a plant-based lifestyle.
Yeah, I think for many people, the diagnosis of multiple sclerosis comes in different ways. And for me, I had been pretty much feeling well. Looking back, was I maybe having a little bit of fatigue? Perhaps, but otherwise I had fancied myself as a healthy person. And so, of course, the idea that a chronic illness would be striking me didn't really enter my mind. And I was flying back from Sweden when I started to notice the vision in my right eye going out. And at first it was just a bit of a blur. But then over the next 24 to 48 hours, it really progressed to complete blindness in that eye. And being a doctor, the idea of multiple sclerosis entered my mind, because very classically, a woman in her 30s with visual changes, that is something that you think about at the back of your mind. But, I have to say, I had always taken my health for granted. And I went to the hospital. I ended up having an MRI. And, I still remember the moment when the doctor turned to a group of medical students and said, well, this brain MRI has all the classic findings of multiple sclerosis. And I have to say, I just burst out crying. And I'm not somebody who's very prone to having melodramatic reactions, but I was scared, and the idea that I would be facing this type of illness was terrifying to me. And, for the first couple of months, I really was in denial, I would say. I started to read books, but I wasn't really willing to think outside the box and think about the idea that the trajectory of my disease could be in some way modifiable. And that's really the crux of what I want to talk about with your listeners today, is the idea that you may be able to have some control over your own disease course. Of course, there are many outside determining factors, but I think that it gave me such a sense of hope to feel like I was doing something that might improve my MS. And if not, worst case scenario, I was going to be improving my health overall.
Good evening, Dr. Donoghue. Was diet the most important component in overcoming MS?
Yeah, so initially, I just followed the directions of my doctor and followed traditional medical therapy. And it's not to say that the medications for multiple sclerosis don't work. I mean, there have been many, many new therapies that have become available, and I think that they have made a big difference in the course of the disease. But I asked him early on about the impact that diet might have. It seemed immediately intuitive to me that diet might, in some way, influence an autoimmune condition like multiple sclerosis, where your body is essentially attacking itself. And in the course of that, I started to learn more about the role that diet may play in different autoimmune illnesses. And when I initially just started with traditional therapy alone, my disease remained very active. I was still having MRI scans every few months, and they were showing many new lesions. So basically, more activity in my brain, suggesting that the multiple sclerosis was very active. But when I transitioned to a plant-based diet, I have to say that since that time, A, I've been feeling well. B, I'm now more than 10 years on a whole food plant-based diet, and I have not had any advances or recurrences of my disease. So clinically, I've been very stable, and my MRIs have been as well.
I'm going to jump in just with a simple question. Maybe for me, maybe for other people, what is MS? Can you give a layperson's definition for us?
Yeah, so much like other autoimmune illnesses, it's where your body becomes confused and in some way attacks itself. So it views something within its own body as a foreign invader, and starts to break it down. In the case of MS, what happens is that the body is confused by the nerve sheath. So on your nerves, you have some basically like insulation on electrical wiring. And in the case of MS, your immune system starts to go after it. So ultimately, it depends which part of either your brain or your peripheral nervous system gets attacked by your own immune cells as to what kind of symptoms you have. But the range of symptoms for MS can range very widely. That you may have images in your mind of people in a wheelchair, and that unfortunately does end up being the course for some people who have progressive disease that affects their limbs or their ability to control their limbs. But it can also be visual changes, vision loss, hearing changes, cognitive problems. So your memory can slide, and pain too. I know that there are a lot of people with MS who struggle with pain or urinary incontinence. So it's a very vast range of symptoms that one can experience with MS. But all of that depends on which part of the body ends up being affected.
Hi, Dr. Donoghue. Good evening. So, could you just tell us a little bit about how your transition to a whole food plant-based diet has affected your cardiology practice?
Yeah, no, and great question, because when I made this decision, I made it as a personal decision because of my MS diagnosis. And, the journey for me to get to that point was that I was reading a variety of different resources on the topic, and we can talk about that further too. Um, but I really did become convinced that making this type of change may have an impact on the course of my disease. But as well, it opened my eyes to the idea that if diet could have an impact on the course of multiple sclerosis, it could clearly have an impact on the course of many different disease types. And in particular, I'm a cardiologist. I'm taking care of patients who are coming in with a heart attack. And, when we look at these, we have lectures frequently among doctors where we talk about the obesity epidemic and how that's contributing to diabetes, and in turn, diabetes contributes to heart disease. But we don't talk about the opposite. We don't talk about the fact that if you were to work on your diet, you may reverse, for instance, diabetes, and you may, in fact, have a powerful impact on heart disease. So, if it works in one direction, why doesn't it work in the other? And that's been, I think, slow for cardiologists to completely appreciate.
Yeah, well, that's certainly been my experience with dealing with cardiologists over the last many years. But is there a direct link between MS and cardiovascular disease itself, or is it just eating a healthy diet will help you in general?
Yeah, it's an interesting question. I mean, there have been some studies that have suggested that people who have MS are at higher risk of cardiovascular disease. And it gets kind of to the crux of what you're saying is that um, we know that inflammation plays an important role in developing heart disease of all kinds. And some of these autoimmune states are driven by inflammation. So, other conditions like rheumatoid arthritis, for instance, there does appear to be an association for inflammatory conditions, such as autoimmune diseases and cardiovascular disease.
Right. Thank you so much. Yes, inflammation is key.
It really is. And poorly understood, may I add. I think even though we've understood probably over the last 15 years that inflammation plays a role, therapies that have been targeted towards reducing inflammation have been slower to come along in the pipeline. So that's an area that's still being intensely investigated in terms of having drug therapies, for instance, that are effective for quieting inflammation and then hopefully reducing the risk of cardiovascular problems.
Well, that's a good segue to my next question, because I know you're doing some fascinating research with Timmy, and we could spend a whole day talking about it, I'm sure. But if you could just tell us briefly what you're researching right now.
Oh, sure. Yeah, so I work with a research group called the Timmy Study Group, and we're an academic research organization. So we're based out of Brigham and Women's Hospital, which is affiliated with Harvard and Boston. And we conduct large-scale clinical trials for novel therapies that are in development. And some of these, are very interesting. A lot of them are targeted along traditional pathways, so to speak. So, cholesterol-lowering drugs. Some of which are newer. So right now I'm working on a therapy that lowers a type of cholesterol called lipoprotein little a. And that's a target where we have not yet had an effective drug to lower it. But, with all these drug therapies that are available, it's remarkable how much of an impact truly that diet can have as well. But of course, it's all too infrequent that these clinical trials are really able to tackle diet as an intervention because, either they don't have the funding or it's also hard to necessarily randomly tell people what type of drug or what type of diet they're going to be following. People are much happier to reach for a pill. So it takes more convincing and these types of educational programs to really help people to understand.
If I could just follow up briefly on the lipoprotein A, very interested in that. I know that one of the drugs that you were working on, I think, was about to go into stage 3. Is it in it now?
Yes, no, it is in phase 3 testing. And this is a therapy that works through what's called RNA interference. So it basically prevents that lipoprotein little a protein from being made, stops the body from synthesizing it. And so it dramatically lowers the levels by, more than 95% at some of the higher doses. So it's exciting, to potentially have some therapies. And for those who are less familiar with LP little a, this is thought to be, some people describe it as cholesterol with Velcro. That basically it's the stickiest and perhaps most inflammatory type of cholesterol we have. But the traditional therapies that lower cholesterol, like statins, for instance, don't touch it. That, if anything, it actually raises LP little a little bit. So that's why there's been a lot of interest in finding therapies that lower it.
Just another question about Lp(a). Do you think that diet can possibly affect it, or just eating well generally will keep down your LDL, which is what the cardiologists now are basically doing to treat it?
Well, we know that a plant-based diet can have a profound impact on your general lipid panel. So what I mean by that is your traditional cholesterol metrics that you get measured when you go to get your annual physical. So yes, a whole food plant-based diet can have a very profound impact on LDL cholesterol, triglycerides. Actually, my husband's a perfect example of that. I sort of rigorously watched his diet for several weeks, and we saw just a very profound change in his lipid panel. When it comes to lipoprotein(a), it's a little bit trickier. The levels are largely genetically determined.
Yeah.
That being said, there have been some interesting studies suggesting that a whole food plant-based diet may be able to lower your Lp(a) levels. Now, I'll admit that the data are mixed there because, again, I think there's a very strong genetic component. But there are some encouraging signs that diet could have an impact.
Doctor,
Thank you.
does your research support your belief in a whole food plant-based diet and a lifestyle?
Yeah, no question. I think that the more immersed I really became in the impact that disease can have on various diseases, I just, began to appreciate the role that it may play not only in autoimmune conditions, but in cardiovascular disease, in several other types of diseases, and perhaps even in cancer risk. I have become a very firm believer that it plays a role there too. I think in the case of multiple sclerosis, there's some interesting science to support the idea that, for instance, cow's milk may be one of the reasons that your body gets confused and starts attacking itself. That there is some what they call mimicry, where basically the protein in cow's milk, looks similar to the myelin sheath that I was describing that's on the nerve. So that type of confusion is valid and may explain in part, why there does appear to be an association, for instance, with dairy and type 1 diabetes and multiple sclerosis.
Isn't that confusion also part of most autoimmune diseases? Isn't essentially that what happens?
Yeah, it's basically the concept is that there's confusion,
Mhm.
and what drives that confusion? It's always hard to tell with absolute certainty. But some of these association studies have been interesting for helping to shine a spotlight on what some of the potential reasons might be.
Doctor, please tell us about the book, Overcoming MS book, with George Jelinek.
Yeah, so George Jelinek is he was an emergency room physician in Australia, and his mother had died of multiple sclerosis. She'd had a very difficult course, and he was then diagnosed with multiple sclerosis himself. And of course, in his mind, he immediately went to that place of recalling how his mother had suffered with the condition. And so he really dedicated his life to better understanding the evidence for how to do well, how to live your best life with multiple sclerosis and potentially, reverse or slow down its course. And that was for me the book that actually really opened my eyes in many ways and really sort of tipped the balance towards me making that change for myself. Because he walked through in a very evidence-based approach, which, as somebody who does clinical trials for a living, that was a way of approaching the data that resonated with me. But in short, what he was endorsing was essentially a whole food plant-based diet, albeit in his recommendations, he also includes fish, which is a little bit different than just being completely whole food plant-based. But nonetheless, I think that's predominantly the strategy, but also additional lifestyle factors that are of importance and I think would be of benefit for almost anybody, such as meditation and exercise. I think that those are probably good advice for all of us to follow.
Thank you.
So, George Jelinek, I know, relied on the swank diet, and that was also the basis for a lot of the early research into possible MS cures. Can you explain the differences briefly between the whole food plant-based approach and Jelinek and the swank approach? I mean, you don't have to go into detail about all
Details.
three of them. It take a long time, but do you, I guess what I'm driving at is, do you follow a whole food plant-based diet, or do you follow more the Jelinek approach or the swank approach? And if you do follow a whole food plant-based, what caused you to do that?
Yeah, so, I think in brief, Roy Swank was a neurologist who had the benefit of following his MS patients for decades. And he basically became a very firm believer that saturated fat, largely from animal products, might be a primary driver in this condition. And so he encouraged people to follow a very low-fat diet. And you're basically restricting saturated fat intake. But a large part of that was really eliminating meat intake. And, I think that what George Jelinek then did was he believed in the foundation that was set by Roy Swank. And I'll just mention as well that Roy Swank published some of his results in a very high-tier medical journal, showing not in a randomized trial fashion, because I'll say that is sort of viewed as the highest level of evidence, but on an observational basis, that those patients who followed his recommended diet had a dramatic drop in their rate of what's called relapses in MS, which is essentially disease progression. So that there was a dramatic benefit that appeared to exist for those who followed that type of diet change. Now, Jelinek took that a little further and also, I think introduced the fact that dairy might play an important role based on his review of the research. And so that was sort of an additional element of that. George Jelinek, feels that omega-3 is an important addition because that might be lacking for people with MS. And so has endorsed fish intake for that reason. I personally follow predominantly a whole food plant-based diet. I would say, 98% of the time. And I do have some fish intake here and there. But I would say today, my entire day was 100% whole food plant-based. I love going to the salad bar, loading up on everything. And I, had a nice plant-based soup with it for lunch. So, I find that overall it's easiest for me to just follow a clean whole food plant-based diet, and I get sources of omega-3s from plants.
Can I just
chia seed on my cereal?
Just to follow up on omega-3s, do you recommend that people who are not eating fish mostly have an omega-3 supplement if they're having a whole food plant-based diet?
No, I don't think that that's necessary. I think that if somebody is following a whole food plant-based diet, then you are getting all the nutrients and benefits of that you need. I don't think that overall people need to consume fish, for instance, or take an omega-3 supplement in order to have cardiovascular benefits. There have been studies suggesting, I'm a cardiologist, and there have been studies suggesting, for instance, fish oil may benefit some people with heart disease. But again, that has not been compared to following a very clean diet. And I think that by and large, you can obtain your omega-3s through consumption of whole food plant-based strategies. And it's not clear to me that there'd be any additional benefit for somebody for taking additional omega-3s in that setting.
But taking flax and chia seeds and having that as part of your diet clearly has a health benefit.
I wouldn't say clearly, but I do. I think that it's always hard I think part of the challenge, with any type of diet is to say, oh gosh, you must take blueberries. Blueberries are the key. Overall, you just have to view this as all a big global approach, and how am I putting as many healthy foods into my body as I can, and how close to nature are they? And I have become a firm believer that meat and dairy do not need to be a part of that, and that they really contribute primarily to disease.
Doc, is your entire family plant-based?
My son, yes. So he's my 2-year-old is completely plant-based, and my husband, I would say, he is very happily plant-based at home. He will occasionally eat some meat outside of the house, but he is a huge fan though of trying to be as plant-based as he can himself.
We have a question right now from one of our viewers, and it's about what are your thoughts of nitric oxide supplements if you don't eat a lot of greens? Is that a good alternative if you're not getting it from spinach and leafy greens?
Yeah, I mean, I definitely encourage people to eat greens. I think that we do believe that nitric oxide plays an important role in the health of our blood vessels, especially for people with heart disease. But I would say that the supplements themselves probably don't work that effectively. Um, so no, I don't normally endorse taking the supplements. There are some people with heart disease who benefit from taking sort of nitrates, and that can help with keeping blood vessels dilated. But normally, I don't rely on the supplements per se.
One of our viewers asked, since they're saying that you're not seeing outpatients, but are there other plant-based cardiologists in the Boston area?
Yes, absolutely. Yeah, so I see patients in the inpatient setting, and I love to ask people when they're in. It's such a great teaching opportunity if somebody's hospitalized with a heart attack to talk to them about diet. So I do really appreciate that chance. But in the outpatient setting, there are other physicians. For instance, Dr. Blankstein at Brigham and Women's Hospital, as well as others in the Boston area, who I refer regularly for people who are interested in the impact the diet can have on cardiovascular disease.
Another nitric oxide question just came in, which is, are there any herbs or spices you can recommend that boost the nitric oxide pool throughout the day?
Yeah, not substantially. And again, this hasn't been studied in a rigorous way, but no, and not. We basically feel that the herbs and spices in and of themselves are probably insufficient to make an impact. But for those who are able to consume leafy greens, that is always a good strategy. But again, it's not just on a once in a while basis. It really has to be sort of a regular part of your diet.
We are running out of time very quickly, and one thing we didn't get to at all, and I know you had mentioned it in another interview, is the role of the microbiome. Is there a 30-second conversation point about maybe the intersection of the microbiome, MS, and cardiovascular disease that people need to know about?
Yeah, no, it's really interesting research that's being done. And I think finally neurologists are starting to accept the role that diet may play in diseases like multiple sclerosis, because there's been a strong association that's been described now between the bacteria, the healthy bacteria that live in your gut, and whether or not that in fact is the trigger that might set off multiple sclerosis. And I've made the joke a few times, but it's interesting that the neurologists initially were just collecting fecal samples, so collecting people's stool and studying that and thinking about whether or not stool transplants may make a difference in the disease course, for instance. But they were not spending a lot of time looking at what people were eating. But well, what goes in one end is what's coming out the other, and so I think neurologists are starting to realize that to some extent. And there's been more of a focus on what's going in the top end as opposed to just what's coming out the bottom.
That's probably a good place for us to wrap up Dr. Donoghue, we want to thank you so much on behalf of Planned Parenthood Metro New York for taking the time, for sharing your wisdom, for sharing your thoughts, and for being such a role model for the community and for people who are looking to improve their own life. So thank you for being here.
Oh, I thank you for having me, and I really appreciate all the work that you're doing to promote this information.
It is our pleasure. So we have coming up next month, Heart to Healthy Heart. We'll welcome cardiologist Dr. Monica Agarwal to our broadcast. It'll be on Wednesday, the 26th of April at 7 o'clock. And remember, if you're not watching this on demand, but watching it live and you want to watch it again or any of our episodes again, they are all on the Plant Powered Metro New York YouTube channel. On behalf of Judith, Ben, and myself, I wish you optimal health, a great evening, and hope to see you once again on Heart to Healthy Heart.